Jake Montez. Thank you all for coming out tonight. Today we're facing a demographic shift. America's youth are more racially diverse than ever, while the senior population is rapidly aging. This racial generation gap discussed by Scroggins and Truehaft threatens the social compact between young and old, unless proactive solutions are implemented. I propose community care hubs, which can serve as critical infrastructure to bridge the widening divides in race, class, and generational experience by providing inclusive local access to essential support services. Community care hubs aren't about charity, they're a strategy. These care hubs can be used to address systemic disparities and reallocate limited resources to the neediest of populations, those with the fewest options. Seniors are less likely to support funding for community programs when there's a racial gap. In fact, every 1% increase in racial generation gap is linked to 1.5% decrease in per child education spending. This growing disconnect means communities of color, especially youth, face chronic underinvestment in schools, public programs, and social safety nets. These safety nets which have provided support for families for many years. At the same time, DEI programs, which help to create these types of programs, face political backlash, which is often rooted in cultural fear more than factual critique, according to Trip Jennings of nmindepth.com. Care hubs offer an alternative framing of practical support over ideological labeling. Community distrust of institutions is high, particularly in marginalized neighborhoods, due to a history of top-down solutions that ignored the lived experience. Care hubs can offer cradle-to-career support, combining access to food, mental health services, healthcare services, education, career guidance support, and family services, all in one trusted location. The model for establishing these hubs aligns with guidelines similar to community centers. Cities with high populations see measurable improvement with targeted investments in high-need communities. Implementation of this policy will ensure communities get a hub to receive care. These hubs aim to reframe equity not as ideology, but in a logistical sense. They serve to meet tangible needs like housing, literacy, and nutrition in communities already doing the work informally. These hubs would amplify existing assets, public schools, churches, libraries, existing community centers, private entities, and they would offer structured coordination, not redundant programs. Community-based programs are more trusted and effective when they are participatory, not imposed, a foundational principle in equity planning. Are you concerned about costs for implementing these hubs? Neglect costs us more. Through emergency rooms, unemployment, intergenerational poverty, care hubs shift funding toward prevention and empowerment. Does it worry you that this might replace family responsibility, like Soul, who states that equality is the thief of potential? Care hubs do the opposite. Families get to be families, not case managers, crisis responders, or bureaucratic interpreters. These hubs sound like hippy-dippy nonsense. Politicians fight to keep these programs away from the public. in order to move funding to support the ward efforts. The resistance to equity is often based in misinformation, not evidence. Misconceptions about DEI have been weaponized in school board politics and in the news, despite a lack of substantive curriculum presence. We have the buildings, we have the people, we lack the coordination. Community care hubs create that structure, so providing efficient, visible, collaborative supports. Building these hubs isn't radical, it's responsible. They deliver what governments often promise, but fail to integrate. Looking for a human over money philosophy. These care hubs would help repair the social contract, restoring intergenerational trust, and reinvesting in our shared future in communities long left behind. If we don't build solutions together, we inherit division. Community care hubs are a bridge between generations, between races, and between surviving and thriving. I ask you, please support creation of community care hubs. Thank you.